again, on behalf of the East African Learning Collaborative, which is hosted by CARE International Uganda and the School of Women and Gender Studies, Makerere University, I would like to really welcome you to this, what we call capacity building seminar on the social norms exploration tool. As some of you already know, that this network is focusing on understanding and networking of different individuals and groups that are working on social norms in programs, in research, in advocacy, and monitoring and evaluation. This is once again, another of the capacity building session that we'll have following the other three, where we explored an understanding of what social norms are. As a network, we have been engaged in a number of activities that bring us together in meetings and also sharing resources. But for this evening, we are privileged to have our key facilitator and moderator, who is going to take us through the social norms exploratory tool, but also with a group of experts and panelists who will be sharing their experiences regarding this tool. Many of us, including myself, I've read about it, but have not really applied it. Some of you could have applied it. It is a key tool that is now being applied and used in exploring and understanding social norms. Why you are interested in social norms? We know that social, and especially for us, many times we call them gender norms. That is our main word. We don't want to miss out gender norms. The point is that these gender norms are the foundation, like the bedrock of quite a lot of the gender and social inequalities. And for a long time, we have not really understood and explored them in depth. So although now we are, globally and even in the region, there is a lot of interest on understanding, exploring, measuring, advocating, and researching, and developing appropriate tools for exploring them to address the inequalities or to understand some aspects of society wide and what drives them. I'll not take a lot of time. I'd like to introduce Kathleen Baker. In Uganda, you may call her Baker, but in the US, it is Baker. She is an assistant professor of the University of California, San Diego. She's within the Center of Gender Equity and Health. She holds a Doctor of Science in Social Epidemiology from Harvard University. Her research centers on examining the role that gender and social norms play in shaping adolescent sexual and reproductive health outcomes, as well as the multi-level examination of risks and resilience factors for gender-based violence in the United States. She has been involved in the social norms exploratory development and training, including most recently for the Save the Children project focused on adolescent sexual and reproductive health in Mali, Burkina Faso, and Niger. So as you can see, we are so privileged to have, she's the right person to lead this webinar. She is experienced, she has the knowledge, she has been involved in developing the tool and has also applied it. She will ask her later on, once she finishes introducing the tool, she will introduce the three panelists that are going to discuss and share their experiences on the social norms exploratory tool. So on behalf of the network, we are super excited to have this seminar, and I'm not going to waste any more minute. but to invite Camilla first to give some sort of Zoom housekeeping issues, so that we immediately begin with the tour thereafter. So you're most welcome, and I'm glad all of you those of you who have attended, I'm sure will benefit from this seminar, and we'll be able to apply it. And if we need more, we'll also find ways of more capacity building and training and sharing of resources. Once again, you're all most welcome. Thank you very much. Camilla, please, a minute for Zoom housekeeping.
Thanks so much, Professor Grace, and good evening, good afternoon, everyone. Just a few housekeeping items ahead of the webinar. We're asking that you please put your microphones on mute during the presentation. And if you feel comfortable during the question and answer part of this webinar, to please share your video. And also, if you have questions during the webinar, please go ahead and add those into the chat box. And at this time, many of you have already started to introduce yourself. And if you haven't already, we'd like to get to know you all a little bit more. And finally, you can also raise your hand using the option in the Zoom features during the presentation if you have any questions. All right, and with that, Dr. Barker.
Great. Thank you so much for that kind introduction, Professor Grace, and the great overview of gender norms and the importance of gender norms in your work context. I'm very excited to be here with all of you today and to provide an orientation to the social norms exploration tool. I was happy to hear that some of you may have already applied it, just so that I can get a sense of who may have already had some familiarity with the social norms exploration tool. Camille, would you mind stopping sharing your screen so that we could see all the participants? If you have used the social norms exploration tool, or if you have heard of it before and maybe read the guide, could you please give a thumbs up with the reaction button so I can get a sense as to how many people may already have some experience with the SNET? I see no thumbs up. Does anybody, do you know how to do the thumbs up down on the reactions button? Is that something that people have used before, Camille?
I think, yeah, it is at that smiley face members, those of you who have heard about this tool and have used it, you can definitely do a hands up like that one. Mm-hmm.
So it looks like most people have not had experience with the SNET. So I'll provide a very high level overview. And then, like Professor Grace was saying, we have some expert panelists who have used the SNET before and will provide some insights into their experiences. So we're hoping to keep this a very practical and real world session. I would encourage you all, if you have questions along the way, to please type them into the chat. And like Professor Grace said, at the end of the session, we will also open it up to questions to help answer some things that you all may have at the top of your minds after going through the orientation. So with that, I'll be providing some overview slides, probably about 20 minutes for that, and then we'll open it up for discussion, or open it up for our panelist discussion, and then into questions. So Camille, if you don't mind opening or screen sharing again, thank you. And we can go to the next slide. Okay, so, and thanks again for the Zoom reminders. Yeah, you know, always good to have those. So we'll start with an introduction on social norms, and Dr. Grace has already provided a great overview on gender norms. We'll get into that a little bit more, and then we'll move into what it means to assess norms, know that they're present in the communities that you may be working. Then we'll move into an overview of the social norms exploration tool product and process for conducting a social norms exploration. And we'll provide a high-level overview of how to use those findings for both your practice and your programs. And finally, we'll move into the expert panel on SNET experiences and lessons learned. And again, we'll be discussing at the end, but please feel free to drop any questions into the chat if they arise, and I'll try to answer them along the way. Next slide. All right, so what are social norms and why do they matter? So on the next slide here, we see that social norms are really the implicit informal rules that most people accept and abide by in a community and in a culture. They're influenced by the belief systems within that culture and community, as well as the perceptions or what people think others are expected to do and how they're expected to behave in that community. They're also influenced by perceived rewards and sanctions. So I'll get into an example of this later. Norms are embedded in formal and informal institutions and produced and reproduced through social interaction. On the next slide, we can see that norms really permeate all levels of society and societal structures. This is the ecological model, which really shows us through all levels of society how we move from the individual, which is nested in relationships within communities, and then the broader societal level, that norms move from all of those levels. So at the individual level, attitudes and beliefs may be shaped by these norms. The way that we interact with one another will be shaped by norms. And the community really helps to enforce and sanction the norms. And societal norms may include, for example, policies or laws in the society. I would like to iterate here what Professor Grace said, is that gender norms are one component of social norms. They center on masculinity or femininity that express the expected behavior of people of a particular gender and often age as well in a given social context. And they often reflect and cement those inequitable gender and social relations and produce those social inequalities that we see between women and men. We wanted to provide this definition because gender norms is something we hear in our work too. And for that purpose, it's important to remember that gender norms are one type of social norms, and they're defined based on gender roles. They aren't different in any way in how they work or operate, the difference between social and gender norms, but they're different in how they influence people and the behaviors that those individuals would take. Okay, so the next slide really provides a distinction of the terms that we are using in the orientation. So a behavior is something you do. Attitude and belief, those are two related but distinct concepts. And attitude is really what I prefer. So, you know, I like coffee. And a belief is what I know. You may have a belief that coffee gives you energy in the morning, which is why I'm drinking it now. A social norm is what I think others do. So a descriptive norm is something that you think others do. So I think that other people in my community drink coffee every morning as opposed to drinking tea every morning. An injunctive norm is what I think others will approve or disapprove of me doing. So I believe there's an injunctive norm that others will approve of coffee drinkers. A gender norm is, as we were just talking about, expectations for how individuals should behave based on their gender identity. And the reference group, another term that you may not be familiar with, but we'll be using throughout the orientation. The reference group are people whose opinions matter to me, especially for a particular behavior or context. The reference group also refers to people who reward or sanction an individual for their behavior. So for example, my research centers on adolescent health. And if you have teenagers, you may know that the reference group that is most important to teenagers is their peers. Parents no longer matter as much as peers do. And those peers are also especially influential in light of social norms because they are the individuals who would reward or sanction the person for the behavior. So in, let's say, a school context, the peer group may socially isolate or make fun of a teenager for behaving in a certain way, and that can be seen as a sanction. Okay, so the next slide it just provides some examples of how all of these operate together. So this first one, I don't necessarily like using violence, which is your attitude. The attitude, again, is what I prefer. So using violence is an attitude here. But many other people in my community spank or slap their children. That's a descriptive norm describing what other people do in the reference group. If I don't use violence, again, behavior, other parents, the reference groups, will ridicule me, which is a sanction, for not properly controlling my children. So you can see all of these are working together. And we just wanted to provide these examples so that it's a little bit clearer. So the next example, I'm waiting to have sex before marriage behavior. My family, my reference group in this case, wouldn't approve if I engaged in premarital sex, which is an injunctive norm. And I know everyone else in my community, a reference group, waits to have sex until marriage too, which is a descriptive norm. And you don't have to really remember this, again, it's just an orientation, but just to get a flavor of what's the difference between a descriptive norm, what others do, and the injunctive norm of your perception of what others would approve of. And the final example, I would like to report that husband who beats his wife in my community, this attitude of wanting to do that. Everyone, the reference group, beats up their wife every now and again, a descriptive norm. And I'd like to just point out here that in the reference group may be somewhat difficult to identify. In this last example, it's everyone. So typically that refers to people in your community or the country, some person's perception of what everyone is. That can be a little bit tricky to define, and we'll get into that later. Okay, so let's move into, why are we really interested in examining and addressing social norms? And Professor Grace, thanks for that great introduction of, social norms permeate through much of our society. And so they really shape the way that people behave. And they're the foundation for many of the inequalities that we see in the work that we do. And so addressing these can help in a number of ways. On the next slide, we see that an increased focus on social norms can help improve development impact, so the work that we're doing, by creating an environment that sustains and spreads behavior change over time. So by addressing the root causes, and for many researchers, we see social norms as root causes for behaviors. If we address those root causes, we can create a more sustainable and lasting effect of the behaviors that we wish to change in communities. In addition, addressing some social norms, such as gender norms, those norms may be driving multiple behaviors. So for example, inequitable gender norms may be driving not only poor contraceptive uptake, but also incidents of gender-based violence and limitations to girls' education. So by creating a more gender equitable space through changing gender norms, you may be able to shift multiple behaviors. In addition, by focusing on gender norms, you may also, and this is linked to the previous one, you may be able to provide a common avenue of collaboration for projects across sectors or divisions. So for example, one project may be working on GBV prevention and another on girls' education. But by working on the one common link between them, you can provide this avenue for collaboration across the projects. Okay, so here I'd like to pause for reflection. So I'll allow you to read through the slide. I won't read it. I'll just let you look at it, which provides an example of many elements in practice. And then I'll ask a few questions and just ask that you either unmute yourself quickly or you can type into the chat. So I'll give you 1 minute to read the slide. And then so in the chat, I'm just going to put in a question that people can reflect upon. So the question is, if you were designing a program, how might distinguishing between knowledge, attitudes, norms lead you to use a range of program strategies to achieve the behavioral goal of women breastfeeding their infants?
Kate, there's a question for you in the chat.
Oh, thank you. Oh, I see. If gender norms are one type of social norms, what are other types? That's a great question. Thank you for that. So one that I work with in my research are also age norms. So for example, early marriage is something that's very related to age norms. So for example, what's considered young, what's considered adolescent, and what's considered old enough to be married changes from society to society. So here in the United States, teenage pregnancy is something that many people believe is relatively socially unacceptable, but that has shifted across time. So adolescence before the 1970s wasn't considered a special period. Today, many people believe that before the age of 18, one should not be having children. So age norms is one example, and that shifts from culture to culture. There are also religious norms that may shift from religion to religion, but largely there are different subsets, but age and gender, some of those other social identities would link to that. But we'll get into more examples of exact social norms. Yeah, thank you, Dr. Grace. So social religious norms, yeah. Age is the first one that comes to mind because it really does, depending on one's age, there are different norms for how one should behave in society. That's a pretty common one. So I think everyone's had a chance to reflect on this question of, if you were designing a program, you might consider, I think many of our programs are focused on knowledge building, right? So here we see in this example that Adam knows that breastfeeding protects the health of infants, right? That knowledge may have been generated through a program. The attitude may have been impacted through the knowledge generation. Now Adam thinks that it would be good for his wife to breastfeed their child. However, these norms pieces, so we have the knowledge and attitude, but we don't necessarily have the descriptive norm yet. So this man still thinks that none of his friends' wives would breastfeed their children. So if we were designing a program, we may wish to not only focus on the knowledge generation and attitude shifting, but we would also want to focus on how we can shift the norms within the community such that people would be more inclined to breastfeed their children. Okay, so on the next slide, we'll talk about how we assess whether norms are present. So what are we working with in our communities? So on the next slide, just a quick definition. A norms assessment is an activity used to rapidly determine the most relevant social norms affecting the behaviors of interest in a specific setting to inform a program of action to guide not only the program design at the onset or early stages of the program development, but also the implementation strategies and monitoring and evaluation across the project life cycle. I'll note here that a lot of the norms assessment work that we'll be covering and talking about today are ideally done at the outset of a program, so early on in the project life cycle, but those can definitely be included and incorporated at different points within the life cycle. So on the next slide, through a norms assessment, you should be able to answer these 4 questions. So who are the reference groups that influence the behaviors? What are the social norms that influence the behaviors? Why do some people comply with those social norms, even if they have different attitudes that conflict with the norms? And what are the most influential social norms? So there may be many norms that would be impacting the behaviors, but trying to identify the most salient, the most pertinent norms to be able to focus on in the program is essential during a norms assessment. On the next slide, we see that there are multiple options for assessing norms. So first and foremost, we encourage a lot of the teams who are doing social norms exploration to review the existing literature and data. There may already be a number of published studies, either in the peer review literature or in gray literature that already talk about the norms. So this could help give you an idea of that. There may be existing data sets too that you could refer to. The next set of types are all primary data collection, and this is the social norms exploration that we'll be talking about today. They all focus on primary data collection. So the social norms exploration draws upon 3 different types. So focus group discussions, vignettes, which are these qualitative open-ended stories that present a story that are designed to elicit some thinking about let's say it's a story about a family who only has enough money to send one child to school, but they have a boy and girl. And so then you would use focus group discussion or individual interviews to try to speak with the participants, the study participants, about the problem that the family faces and what are some of the decisions that the families would make. So this begins to help elicit the information about what sort of decision making and what norms inform that decision making. And finally, the participatory exercises and activities. And these are the ones that the social norms exploration tool really focuses on, and ones that I'll be talking about in just a little bit. One point that I'd like to make here is that formative assessments are done at the outset of programs. And there may be some questions of, well, why are we doing this special social norms exploration process? Don't the formative assessments already address norms? So standard formative assessments, and Camila, you can just make the bullets show up. Thanks. Assessments are often focused on behavior change and may ignore norms. They may indeed, on the next bullet, may explore norms, but not unpack them enough to really take action to fully understand what the norms are and what would need to be done. In addition, program staff may assume they know what are the critical norms, but their assumptions may or may not be correct. So for example, after conducting the literature and one's own perceptions of a community, the program staff or researchers may come into a community with some preconceived notions about what may be impacting that community, but those may not be, those assumptions or perceptions may or may not be correct. I'm just looking at the chat. Yeah, great question. So given the response on other types of social norms, gender, age, religious, would it be fair to say gender norms are dominant form of social norms? That's a really great question. I think that it really depends on the behavior that we're talking about. Certainly for certain behaviors, gender may be the primary or dominant form of social norm or the most salient for that behavior. In other behaviors, though, for example, let's say immunization uptake, their gender norms may not be the most salient or dominant social norm. There may be other factors at play. And then, do cultural norms lie under social norms as a type, or is it referred to as a value? That's also a great question. Social norms cultural norms are a type of social norm. So they're usually the broader norms that are at play within a broader community. So for example, whether or not we eat with chopsticks or a fork, that would be a cultural norm, but it's still a social norm. But it would be a broader cultural context as opposed to more specific to certain communities. And definitely we will share the slides. So let's move into, I want to fly through these so that we can get to our panelists. I'll just do a quick overview of the social norms exploration tool. So on the next slide, the social norms exploration tool really is focused to be and intended to be a participatory learning and action tool that will guide a very rapid social norm exploration. And we keep mentioning rapid because we hope that this could be conducted in a matter of weeks in a community once the appropriate training has been conducted with the staff who will be implementing the social norms exploration. The tool also offers guidance on how to not only gather information about what the norms are, but also how to use that information. Again, in program design, strategy adjustment, and evaluation throughout the program lifecycle. So on the next slide, when we think about who, what, and when, project planners and implementers are really the focus for the social norms exploration tool, especially if they're working with communities and that community-based programming. It includes, so the social norms exploration tool we have it in a PDF format, and it really walks everyone through the various phases, and it includes multiple templates for the data collection process, the data analysis, and then the application of results. So it includes all of the templates, the guidance, and the tools that are required to implement the social norm exploration. And again, it's used throughout the project lifecycle, but it's ideally used earlier on in the project lifecycle. So if you are able to ask these questions and understand the social norms and then implement your program, you'll really be able to design a much more effective program. And on the next slide, there are a variety of different methods for participatory data collection that are presented in the SNET. So we have not only individual interviews, but also group discussion formats for learning about and engaging with the communities. And these participatory methods really enable the sharing of these insights with these communities, really with the eye towards being a catalyst for the community itself to help act on what's uncovered within a setting. So some of the work that I was doing was with a project in West Africa, and we're hoping to continue to, we were using it early on in the program design process, and we saw the social norms exploration as sort of a two-pronged approach. The first was to really understand the social norms, but the other was also to establish and foster relationships with the community members so that we could then come back to the communities, share the results with them, and continue to work with them throughout the project. Let's skip the next slide and go to the SNET process on the next slide. So there are 5 phases. Oh, sorry, Camille, you can go to the next slide. Thank you. So there are really 5 phases to the social norms exploration process. The first is to plan and prepare. The next is to identify the reference groups. And then the next is to explore the social norms. And finally, analyze those findings and apply the findings. So phase 1 on the next slide, there are a number of different activities that would go into this phase. So the first is to do a problem tree analysis. I won't get into that here because I think some of the panelists have probably used a problem tree, but essentially what it is, it's helping to, we call it a tree because it has the behavior at the top, and then underlying the behavior are all of the roots. So what are the root causes that lead to that behavior? And the other steps are to decide on population segmentation. So let's say, for example, let's take the breastfeeding project, for example. We may be working with young parents, and we may decide to segment that population of young parents into the women and the men. We could also further disaggregate by age. So let's say they're very young parents. We may want to target those very young parents separately from the older parents. The next is to really define the aim and objectives. So, of course, we want to learn what the social norms in operation within the community are, but we may have other objectives. So I was just mentioning that there were 2 objectives. The first were to identify the social norms in our populations, but also to establish a rapport with the community that we were working on.
Hi, Kate. We may want to move on to the panelists. We're running short of time.
Okay, thank you so much for keeping an eye on that, Marilyn. Yeah, and we'll share all of the slides and you'll have access to the PowerPoint. So you'll have access to all of this. Let's see. So Camille, we can just, I think, skip through these and go right into the panelists. Let's just go right into the panelists. Thanks for the note on timing, Marilyn. I've used this before and I have, it's very exciting for me. So there's lots of information to share. Okay, so our expert panel. So I'm so pleased we have such an excellent panel. I'm going to, I apologize greatly for my, Camille, do you know the pronunciation of all of the names? Or maybe, no, okay, I'm just gonna try my best. I apologize in advance. So John Bosco Bossimanjera, a senior technical advisor for social and behavioral change for family planning, reproductive and maternal nutrition and children health from the AFIA project with FHI 360. Rahinanatu Adimu Husani, who is the project director for the REACH project with Save the Children International, and Ramandan Kirunda, who is a researcher and as well as a technical advisor for the Monitoring, Evaluation, and Learning for the Impact and Innovations Development Center. So thank you so much to each of our panelists for being here. We've asked them to just provide some brief remarks of their experiences and lessons learned with the social norms exploration process that they've used in their own work. So with that, why don't I turn it over to John Bosco, who can start us off with the remarks.
Thank you so much, Catherine. Hope everybody can hear me.
Yes, we can.
I hear you fine.
Thank you. So I will go straight to just telling a short story or summary of our experience of applying SNET at Family Health International, Tanzania. As you may all know, Tanzania is one of the countries with fast growing population.
John Bosco, you can put on your video, you'll be the only one. Eh? So
Okay,
okay. Yes, please.
Okay, am I visible now? Can you see me?
No, unfortunately, we cannot.
Not yet.
It's on. And I don't want to waste much of your time, guys.
Oh, the Zoom is getting clearance somewhere.
I think that's all right, John Vasco. We can just move forward without your video for this, if that's all right with you.
Okay, let me go ahead. I'm trying my best and I can't. So FHI's 360 is implementing a 5 years project called USID Tulonge Afya, which means let's talk about health, with the aim of improving the health of Tanzanians by transforming social cultural norms and support the adoption of health positive behaviors. The project designed two SBC communication platform. One is for adult called Naweza and is focusing on pregnancy and childbirth package, as well as parenting and caregiving for under 5 to address or to complement the government efforts to reduce maternal and child morbidity and mortality rates. This behavior, the second one is called Tetereki, which means unshakable and is addressing reproductive and family planning priority behaviors among youth 15 to 24. So key behaviors that we address under these platforms for adults, it's for partners of pregnant women and women to discuss with healthcare providers about postpartum family planning options, but also use of contraceptives to avoid or to space pregnancies at least for 24 months. And for youth, we promote condom use correctly and consistently, but also use of contraceptives to delay first birth and space future pregnancies. The project initially supported by USAID and Passage Project. They introduced a SNET tool to the project and the government partners by doing 2 days training, and USAID Tulonge partner and Ministry of Health through Health Promotion section, we agreed to conduct social norms with the main goal to deepen understanding of which social norms are barriers to priority of family planning behavior in alignment with national costed implementation plan demand creation targets. So the objectives were to identify the reference group, the social norms, as well as sanctions and rewards for engaging the target audience in priority behaviors. The quick findings that we had a number of findings, but interesting, I will just present few for the interest of time. The reference groups for married adults, they trust and to discuss using family planning methods with friends, and especially spacing with friends, but also interesting, they trust partners in discussing having more children. Social norms identified for the adults, it is expected in the community that married women will bear many children, and this is associated with bride price paid for marriage. And the reference group for adolescent and youth, as mentioned by the previous speaker, the friends and peer educators were the most prominent reference group that were mentioned by young people. For social norms among youth, this include that family planning is not appropriate for young people. They are appropriate for married older women, and contraceptive side effects may cause infertility and impinge future children bearing. So those are the quick findings, and the experience now we have is that application of social norms, we used it to refine project social behaviors change strategies to include a deeper focus on key social norms and activities to reach and engage and influence audience in support of family planning objective in the family planning priority regions. This included having add-on materials which were focusing on social norms, especially for the ongoing activities in the community, such as the pregnancy package, small group dialogue toolkits, and the community theater activities. We also used it to inform, to design what we call mother meetup events, commonly known as, or designed in the concept of kitchen parties, where women will have that kind of celebration. And this focuses on new mothers, and they talk about integrated behaviors, including postpartum family planning, exclusive breastfeeding, immunization, etc. It also informed us, we had learned that having community discussion, our community group discussion, combine both pregnant women and their partners, it caused a number of barriers in terms of freedom to speak by pregnant women, but also men were not that much forthcoming to attend these meetings or dialogues. So we designed the male focused, what we call kijiwe cha kahawa, or coffee corners. That is specifically for men, activities and dialogue to promote engaging in family planning and maternal, newborn and child health. We also created a series of family planning added to the youth toolkits. We have Juma, which is focusing on community dialogue with young men, and the Tetereki supported discussion with young men around family planning use. From last quarter omnibus survey and DHIS2, we have learned that after the implementation of SNET activities, there has been significant positive gains in the behavioral determinants, such as the confidence of women and their partners to discuss about modern contraceptives, and the confidence of women to discuss contraceptive options and side effect with service providers has increased. We also see some gains in youth who believe that healthcare providers will support use of male contraceptive methods, and those who believe that modern contraceptive methods are safe. We have also seen uptake of family planning services among adult and youth also increasing tremendously. Factors that have facilitated this achievement. Yeah.
I'm so sorry to cut you, but we would need to move on to other panelists.
Great. I think that was my last point, and just want to mention that we had the challenge was the COVID pandemic, which I think cuts across in delaying of implementing the activities, but we innovatively used the digital platform and social media and radios to conduct events. Thank you so much.
Thank you so much.
Thank you so much, Dr. John Bosco. Now we'll hand it over to Rahina Husani. I apologize for the pronunciation.
Hi, Kathleen. My name is pronounced Rahina to Adamu Hussaini. And thank you, John, for that presentation. And thank you to everyone for all the presentations so far. So I'm heading the Reaching and Empowering Adolescents to Make Informed Choices for Their Health, a Save the Children project being implemented by Save the Children, but funded by GAG. So for us, the project the main aim of the project is to improve the gender transformative sexual reproductive health of adolescents aged 10 to 19. Because the project is a gender transformative project, we felt that the baseline that was done for the project was not enough to look at some of those norms, to dig deep into the norms affecting the sexual reproductive health of the adolescents, and decided to do a social norms exploration. And we focused on 4 behaviors. The behaviors include practicing child early marriage, joint household decision-making, intimate partner violence, and the use and non-use of modern contraceptives. So you might think that, yes, we took on 4 serious behaviors, but if you look at it, these behaviors are some of the behaviors that affect sexual and reproductive health of adolescents around the world. So for practicing child early marriage, I think what came out, not very surprising, but kind of came out very strongly for us during the exploration, was around the purity, the need for the girl child to be pure before marriage. And who were responsible for this? Women, mothers were responsible, and grandmothers. Those were the people looked upon as responsible for ensuring that purity. Those were the reference group for this behavior. And then for the joint household decision-making, it was much around the man being the sole decision-maker, the woman being submissive. So those were some of the norms that came out very strongly for joint household decision-making. And then for IPV, it was around the culture of silence. Everyone is doing it. Nobody is talking about it. So why don't we continue doing it? It's okay to discipline your wife. It's okay once in a while to discipline her. So go ahead, it's okay. And then for the use and non-use of modern contraceptives, it was also around submissiveness and not appropriate for unmarried adolescents to use contraceptive. They don't have to use contraceptive. Even if they are using it, it has to be very quiet. It shouldn't be something that should be known in the community. So this was some of the things that came out on our exploration. Our activity in the beginning, when we were planning, when we started implementation, there was no focus around older women. Yes, we have a focus around traditional and religious leaders in our communities, but the exploration allowed us to look deeper, have a deep dive into the findings, and realize that we needed to bring older women into the conversation, not just looking at mothers or mother-in-laws, but then looking at grandmothers, because they were influential, bringing that intergenerational learning between the younger generation and the adult generation. So the exploration allowed us to bring that into as part of our activity, thereby creating social behavioral change communication with this group of older women. So we had to go on, develop this communication, bring them on board some of the training, and then bring them as part and parcel of the project. Excuse me. Excuse me. So the social norms exploration allowed for that. So and then it allowed for us to understand that the importance of intergenerational learning within communities when we go for activities, making sure that these older women and older men have opportunity to participate, to bring out their voices, and to show some of those things that they can do. So for us, I think that was a big win from the exploration. And what were the tools we used? So we used the tool, the social network, to bring out the reference group of our target audience. Our target audience were aged 10. Is my time over?
We may need to wrap up, Rahina.
Okay, okay. I think, yeah, I think I've given the most important part of the conversation. So thank you very much.
Thank you so much. All right, and we can move on to our final speaker.
Thank you. Am I audible enough?
Yeah, thank you so much, Mandan.
Okay. Thank you. I'm like it has been introduced.
Could you say your name again for all of us, because I botched it so terribly earlier?
Okay. I'm Ramadan Shirunda.
Beautiful, thank you.
Yeah, and I work with IIDC as the technical advisor for monitoring, evaluation, and learning. And I want to talk about social norms in three perspectives. I've engaged the tool in three levels. First, from an implementer's perspective, and that was with the family planning program when I was with FHI 360. And now that was the first time I engaged with the social norms tool. The other is as a researcher. We again use the same tool to identify the social norms around type 2 diabetes risk behaviors. Yeah, because type 2 diabetes is a behavioral disease. It's a lifestyle condition. So at that level, as a researcher, I looked at it in that way. The third, time or the third way is as a development facilitator. Now, really trying to support organizations to apply the tool and make sure that they actually generate findings, generate evidence, and act on those findings. So as an implementer, I will not repeat what my colleague from Tanzania, FHI Tanzania said. They were more or less the same, yeah? We had a family planning program and there were lots of issues, low FP uptake, people say it causes cancer. No one had ever, dug deeper to understand, okay, well, why do they say it causes cancer? Yeah, when it's actually known that it doesn't. So we were advised to use this approach to dig deeper and understand why people still think this way for decades and decades. The same problems, same issues, all programs that come try to address the same issues with no success. So we used, we were the first people in Uganda here actually to use that approach through the collaboration with Passages project. So one thing that I think I learned from that was that normally we tended to focus on what we are seeing, yeah, on what people are saying, what people believe, without really going deeper to understand, okay, so why do they believe so? Yeah, what influences them? And it changed the way how we programmed, and we had to actually close the project at 3 years and redesign a new project. Now that was for family planning. For type 2 diabetes, it was really interesting because you may think, okay, this is a disease, this is a condition. How are norms related to type 2 diabetes? Again, we went to high incidence districts in Uganda, and our results showed that it is the normal, simple things that we hear, yeah, that you take for granted. For example, one of the norms was if you do not fry for your husband, then you are mistreating him. So every woman must ensure that they fry very well for the husband. Yet we know frying, the oils, the foods that are high in cholesterol, etc., are risky factors. So we're able to really identify these and begin to rethink. This problem is not a health system problem. It is actually a community problem. Yeah. So if to address it, you don't need to address it from a health systems perspective, but from a social systems and culture perspective. Mm-hmm. And lastly, for the violence against children, we are piloting it with our partners in the East African region. We have a cohort of partners that IIDC supports. So again, there were several practices, that were coming over and over again. Every survey brings out the same factors for corporal punishment, for sexual violence, some issues, and they were not, going away. So we said, why don't we move a bit deeper and understand what are the root causes, who influences them? And we are in the initial stages for this, but we are finding very interesting findings, requiring, a complete change, complete shift in terms of how we look at violence against children and child protection programs, because it's really, it shows that we are kind of missing the point, by following events that we see. You see defilement, you see those things happening, corporal punishment, and you follow those events and forget actually what is causing these events. What signal are they sending and where are they coming from? So we'll definitely be sharing widely around those. What are the key lessons that I think I pick out as I conclude? One is the need from all these three levels, as an implementer, as a researcher, and as a development facilitator. Three or four things. One, redesign. In all the steps, it was taking us to redesign, rethink the program, rethink the implementation approach, rethink who you engage, the reference groups. So it was very, very instrumental in helping us to now leave targeting whole community because it's a problem, but to target the few influencers, and those, it was actually more efficient because you now target fewer people who are influencers at the community level, and you are able to, be more efficient. There was an issue of time frame, of course, this is related now to the donors, to the designers. Now that the problems were norms linked, yet to transform these norms requires a lot of time. There was a problem, Three, competence, staff competence and skills. Social norms is a little straightforward, but it's not as easy as it appears. Many people need to, organizations need capacity. We realized that it's needed, there was need for capacity for these organizations to be able to understand these norms and therefore program to transform them. Again, of course, requiring deep analysis. And again, one very important one for CSOs, for NGOs, and for CBOs. This places these organizations, as in the development world, in a different place as typical facilitators of change. Unless the CBO is identified as a reference group, that they also influence that negative behavior. But it places us in a place where now we're supposed to facilitate change, because the issues are coming from the community, you're identifying the root causes, so you facilitate that change. Even as you're implementing, and then of course taking the social norms from theory to practice is not easy, and we have tested it. It is possible, both at the start, like the presenter was presenting as a formative assessment, also in terms of redesigning at midterm. If you do a deeper exploration, you are able to change your program. And finally, if you do not co-design, and this is from experience, if you do not co-design, if the exploration process doesn't take you to co-designing with the community, then you've not done a thorough exploration.
Oh, Ramadan, your internet connection is cutting out just a bit. Ramadan? Oh dear, I'm so sorry. We can't hear you any longer.
Seems he has dropped off.
Yeah. I recognize we are over our time limit, so many people may need to leave, but I wanted to open it up. I've been seeing a number of wonderful.
Sorry? I was saying that lastly.
Oh, Ramadan, sorry you cut
Hello?
out. Thank you so much. We can hear you now. Go ahead.
It's the connection that is poor. Yep.
Yeah.
Remember that we can't hear you. We can't hear. I think, Kate, we can go ahead and we respond to
the social knowledge exploration process.
Oh, yeah. Ramadan, the internet connection is very poor. I'm so sorry. We'll move into any questions that the audience may have. So thank you everyone for the wonderful panel presentations. I think that was very helpful in understanding how the social norms exploration process can be applied in the real world to help understand what norms may be impeding project process and benefits in the communities. So for example, Rahina's work led to an understanding that, the norm of purity, that a girl child must be pure before marriage, really led to some early marriage. And Ramadan's example of frying food, I think, was very helpful as well. So if there are any questions, please feel free to put them into the chat. Thank you for everyone who's done so already. Or feel free to unmute yourself and ask a question. And if there are no questions, we will definitely have more time with this group.
Kate, can I ask a question?
Oh, of course.
Yeah, the three presenters, do they have like briefs, like reports that they could share with us, with the participants, so that definitely we've learned a lot through the discussions, and because the experiences are application, they would be really very, very useful. Is there a possibility to have those either write up or maybe the reports of what they have done, something that may be useful? Yeah.
We will reach out to them to ask for those, and any that are available, we'll circulate to the group.
Yes.
I see. Oh, John Bosco, did you have something you wanted to add?
Oh, I wanted to respond that we already have the social norm exploration report, which can be shared. And I think my colleague Mark from the M&E team can even post it on the chat box now if he can, but we can also share it with you, Kamel, then, or Kathleen, and then you can share with the rest.
Great. Wow, that would be great. Thank you so much. If they post it in the chat room, great, but also we can receive it from Camille.
Yeah, that's possible.
Wonderful.
Yeah.
Thank you.
I see a few questions. Maybe we'll start with Caroline. I see your hand is raised.
Okay, thank you so much, and thank you for the discussion. I was wondering whether the panelists actually, by any coincidence, found out positive norms, because I usually hear people when they're talking about social norms, they only talk about the negative norms. But I also know that if you find out the positive norms, you can actually use the positive norms to undo the negative norms. So I'm wondering whether when they're using that tool, they are able to also track the positive norms and how they can actually adopt the positive norms to help societies undo the negative norms. Thank you.
Thank you. I think Rahina has had to leave, but Ramadan or John Bosco, do you have any comments about how one may use positive norms to help undo the negative norms?
Probably my colleague, Mark Ruakatare will chip in if he's around, but our social norm exploration was looking at the negative social norms because those are the ones that we wanted to address through the project implementation. But I agree with her that there are positive social norms, especially those ones that encourage delay into sexual debate for adolescents. But also we may need to look on how we use them rather than being descriptive, be one that is understood and accepted by young people. So I don't have an example of where we have used it to explore the positive social norms to improve the SPCC activities that we are doing.
Great, thank you. I see another question from Kikuma. Julius?
Hello, thank you very much. I was even wondering if I should continue with my hand up, as since my question was really for, is it Rahim Hussein? I was drawn to the experiences she was sharing about the social norms around intimate partner violence and this whole question of a culture of silence. I had wanted her to share more in terms of how did they, kind of intervene, or if there are any tools they kind of used to deal with that. Why I am interested in that is we are also doing something relating to this question of sexual harassment, and we have this same problem around people not wanting to come out and actually bring out the problems, because sometimes it is considered, especially if people are in some kind of relationship, and yet there is an abusive partner. There is a way that it's not your business. It's a business between me and my partner. And sometimes when people try to intervene, and then they try to either deal with the abusive person. Later, when the woman gets back to this person, she will say that leave us alone and so on. So people become a bit. They find it hard. How do we deal with this when it is like an internal and a private matter? But she's gone, so I'm not sure whether I should continue to expect some experience. But maybe the whole, the other people who are here, they could just talk around it.
I see Dr. Ramadan's hand is up. Maybe Dr. Ramadan, do you have something you'd like to add here?
Now, I think I wanted to speak to the positive norms, yeah? And I'll give an example. Am I audible?
Yep, we can hear you. And we'll come back to Kikuma's question.
Yes. Religious. We found, for example, that the other norm, positive norm, was that religion does not allow us to drink alcohol. Yeah. Now that was a positive norm. If you do an exploration is open-ended. Yeah. You don't go out looking for only the negative norms. There could be positive norms around a practice, say maybe education. So because one of the strategies of transforming a norm is to actually identify norms that are positive. Yeah. So you reinforce those norms. So in for example, that type 2 diabetes study, we found out that one of the very strong norms across all the reference groups, yeah, that we interviewed, it was clear that religion does not allow us to drink. So how do you use that norm, okay, to have it diffused in community structures, so that there is a new norm that is being promoted as opposed to the negative norm. So positive norms come out, and they are very instrumental they are one of the strategies actually for norm transformation and change.
Yeah, I would also like to add on something. I have my hand up. There's a question in the chat regarding myth versus norms. If we can respond to it, and when does a practice become a norm? That is also another question. But I wanted to comment on the positive and negative. Normally for this tool, you don't go in the community looking for negative norms. You go into the community looking for norms that are associated with that practice. And through the movement of analysis, then you are able to tell that this norm that is associated to this practice is having negative implications for the subject that you are dealing with. If you are dealing with adolescent pregnancy, if you are dealing with domestic violence, so it is at that point that you actually, and normally they tell us not to mention positive and negative, but we just look at the associated, these norms are associated with this practice, and people adhere to it, the significant others, the reference groups, but the outcome is that it is affecting, and it is at that level that we see that this is having a negative effect on the outcome that we are dealing with, either reproductive or unpaid care or something like that. That's how it is. I think if you go in that you're looking for negative ones only or positive, I think then that may be problematic. But we are looking for all, and we document all norms that are associated with a practice, and then I'm moving through the analysis, which we are, I'm sorry, Kate didn't really finalize it, analysis and see the effects of what do they produce when they intersect with this very issue that we are dealing with. That's what I wanted to add on. And eventually you find that some of these norms actually are producing good, positive outcomes in a way, and those, that is at that point that as a program, maybe you want to project those or even scale them up or talk about them more. That's what I wanted to really say.
Thanks so much, Professor Grace. I'd like to go back to Kikuma's question and wondering if anyone has any thoughts on that.
Right, I didn't pick him quite well.
Okay, Kikuma, could you recap what question that you had?
Thank you. What I wanted is if there is an intervention around this challenge of a culture of silence, especially with regard to intimate partners, when they're in a relationship that one of the partners is really abusive, and yet it is difficult for any person outside of the relationship to really come in at some stage when the partner is abusive, and sometimes you find that when some people come in, it is considered a private matter. Other people are not supposed to come in. We shall sort this out. Then the same problem continues. The next time again, this man beats up the woman, and this kind of thing continues. So people end up saying, okay, now what can we do? Maybe this is their internal matter.
Yeah.
So the culture of silence continues.
Thank you.
I think if I can attempt, that is the whole purpose of doing the influence mapping. If this person is identified, okay, yes, the woman is silent, is not talking about it. If it is just isolated in their locality, in that village, and it's only that woman, yeah, perhaps there are no social influences. But if that man and others, yeah, beat their women, you don't target the woman, yeah? And to understand the woman, you may not understand her from her perspective, but maybe from her social network, yeah? For example, like a prof was saying, you don't go trying to find out, do they beat you? No, it's, for example, what do people think when, or what do you think about a husband beating you, yeah? Or if you're beaten, how do you take it? How do you feel? Is it common in this area? Not targeting this particular woman. And you've asked me if women want to really talk about issues of intimate partner violence, who do they talk to? How about you? Who can you talk to if it happened? Yeah. Now you begin to really to identify these deep-rooted issues, but also remember the influence mapping and the social networks. It is individual. It is one-on-one. Yeah. So the skill, the skill of the team must be, the research skill has to be there, that this person must trust me. There's a consent process that, we are going to talk about these issues. It's between me and you, nowhere else, and it's one-on-one, yeah? So you are able to identify these through the influence mapping process, so that you go through the networks, who influences the husband, who does the husband listen to? If you are now going to begin at the analysis level, whose opinion matters most to that, husband? And then you begin to get, behavior influencers who can talk to this man, not directly that we were told that you beat your wife, no, but in their group, without even the wife knowing, the man is now, going through stages and interventions and mentorship about how men can be. Thank you.
Thank you. Yeah, and I think that's a really important point, that through this process, it's not meant to understand individuals, but rather the broader norms within a community.
Yeah, excuse me.
Please go ahead.
Yeah, my name is Marco Kataris. Sorry for jumping in late. I just want to cement on JB's presentation, I can say, on what we encountered. Of course, he has provided a snapshot, but we had a lot of detailed insights that we uncovered during the social norms. And of course, you're right. The whole purpose of this SNET experience was to actually uncover norms, both positive and negative. And we did encounter some positive norms as well. It's only that because at the beginning of our project, when we were at the inception phase of the project, we conducted a lot of formative research around many issues, I can say social factors. And we uncovered a lot of negative social factors, particularly on the perceptions and the attitudes towards family planning and the behaviors as such. So going back to the point, for example, in the SNET experience, we uncovered some positive norms. For example, the negative was that people don't expect couples dialogue to be a common thing, particularly around issues, for example, on number of children, family size, and also the continue or discontinuation of family planning methods. But what we came to understand is for people who actually adopt those norms, people who actually embrace couples dialogue, they're perceived in a certain way by other people. They're perceived as people who maybe think they're better than others. They think they're more informed than others. That's why they involve in such behaviors. Or other people will think these people don't want to have many children. Maybe they think they don't want to spend a lot on additional children, which for other people, we think that is actually something which is positive, because if someone does something that is maybe, let's say, contrary to others, as maybe as a positive deviant, that is something you can leverage on going forward. And us as a project, we're trying to promote such behaviors in our interventions. But as well as also when you look at the youth, we kept on hearing that family planning is for people who are married, for people who are older. But when those people who enter marriage, the expectations change. And you can see from our experience, as in people who get married, the expectation is that they have to have many children. And it's because the male have come from backgrounds of extended families where there are many dependents. So what they think is it's the norm to have many children. But when other women are growing up, they're told family planning is for older women. So we're seeing a discord even in between generations. People are being told one thing, but when they enter the experience of marriage, the things are different. So we kept hearing a lot of things, even around in-laws' expectations. The mother will talk differently to the son because the son wants to live up to the father's lineage. But when it comes to the female side, they're told we want more children, and this is what we're expecting from you. So with this, what I've learned from the social norms experience is you don't know what you'll find until actually you indulge into more probing. And also it depends on, like Ramadan talked about, you need to have that researcher skill set that actually is very I can say let's say how can you put it, flexible, or in the sense that when you see things are going different, you change your way of questioning people and getting insights. So we'll share our report and see what we found out. But also in the conference on the 23rd, also we'll present we'll be doing a presentation on what we encountered. But I can say is we should always embrace what we find in the field and also build on that.
Thank you so much. And I think that's a perfect way to wrap up this orientation. Thank you so much for everyone's comments, excellent questions. And again, a huge thanks to Professor Grace for hosting us, as well as to the three panelists, John Bosco, Rahina, and Ramadan, for their excellent comments and insights. As you can tell, there's much more to discuss, and we will look forward to speaking with you all again and delving into more of the details of the social norms exploration at a later date. With that, Professor Grace or Camille, do you have any concluding remarks?
Yeah, I think on behalf of the, Madam, are you still around? On behalf of the East African Collaborative Network, Madam, are you there? Madam, if he's not there, I can just really thank, Kate, our moderator, and who took us through the tool. And the panelists, I mean, I wish we had like 3 hours. You could see we still wanted more, and I think we are going to discuss and see if we can have another in-depth engagement of this tool and sharing the experiences, because this is the core really business of our network, to learn from each other. And I can comfortably tell you that we have learned a lot. We'll definitely share the slides, but would love, we might actually schedule another time where we can maybe go through, walk through the tool more and see how we apply it in our situation, but definitely this has been very useful. It builds on the earlier presentations which we had on defining the understanding social norms. And I remember we also had exercises on the problem tree. And so I think we put together all this information, those of us who have attended all of them, to help us learn and apply. And there's no doubt from the experiences that this tool actually unveils or unpacked some of the deep-rooted norms and beliefs that definitely have consequences on the different outcomes. And I think that is the greatest point, that you walk through with individuals and you look, and to change a norm, people must see what are the consequences, whether positive or negative. And for any norm to change, they must see significant others, many of them behaving in a way or changing their behavior. So it's changing behavior, and we see from the presentations how the tool was able to move to begin on the changing of some of those behaviors, or people understanding how the consequences actually, that's the influence of this norm on a different outcomes. I think this is great. So thank you very much for the presentations. On behalf of the network, I want to thank the participants. Many of them have really stayed on up to the last moment. Madam, I see you are showing, do you want to say one word, and so that we close and end this meeting? But thank you so much. And the panelists, please, we would really love to get the documents and the briefs, so that where we can learn more about your work. And we'll definitely maybe keep in touch with a number of you to learn more. Kate, we know I normally work a lot in sexual and reproductive health, so I'm looking forward to learning more from you and how that has been applied on especially adolescent health. We have a project which we are beginning to look at how young mothers see themselves and what really happened. So thank you so much.
Thank you to everyone.
Participant, thank you.
Thank you so much. It was a great session. We'll see everyone next time.
Yeah, thank you. Camila, thank you so much. And Rebecca, say hi to everybody. Yeah. And good evening and good morning. I think some people either good night or good morning, but for us it is good evening. We are heading for 6 o'clock, so we are preparing to have evening tea and then supper and go to bed.
Sorry, Prof, my network has been misbehaving, but greetings to everyone. This is Madanda from CARE. Thanks for sharing.
Okay, thank you so much.
Thank you everyone for the participation. Come to see you again.
Yeah.